Have you ever wondered what happens to your body when you stop having sex? Today we'll address some common questions about the effects of sexual abstinence, especially in women. The vagina can become tighter, fertility may be questioned, and the risk of urinary tract infections might change. If these topics interest you, stay with us until the end. Before we begin, I want to make it clear that I'm not here to promote or discourage sexual activity. Sex can have many benefits, but the decision to engage in it, or not, is completely personal and valid either way. Is fertility affected? The answer is no. Not having sex does not harm your ability to conceive in the future. Of course, without sexual intercourse, pregnancy is not possible, but that doesn't mean your fertility is damaged. Your ovaries and uterus continue to function normally, and abstinence does not increase the risk of developing reproductive health issues. What happens to vaginal elasticity? The vagina is a naturally elastic organ. It can expand to accommodate a penis, a sex toy, or even a baby during childbirth. Once the stretching object is removed, the vagina generally returns to its original shape without difficulty. However, when a woman goes a long time without sexual activity, not just weeks or a couple of months, but many months or even a year, slight changes in elasticity can occur. In these cases, the vagina may feel tighter and less flexible when resuming sexual activity. For some women, this tightness may feel more pleasurable. Others, however, may experience discomfort or even pain during intercourse, as the vaginal tissue may not stretch as easily as before. If this discomfort persists, it's best to consult a doctor. It's important to remember that these changes vary from woman to woman. What is secondary virginity? There's a widespread myth that when you stop having sex, the hymen grows back and covers the vaginal opening again. This is not true. The hymen is a thin membrane that typically only partially covers the entrance to the vagina. If it were completely sealed, menstrual flow wouldn't be able to exit. During a woman's first sexual experience, the hymen might stretch, tear, or in some cases remain largely unchanged, depending on its shape and elasticity. But once it's been stretched or torn, it does not regenerate. What some women describe as secondary virginity is actually a reduction in vaginal elasticity due to a lack of sexual activity. This can create a feeling of greater tightness when resuming intercourse, but it has nothing to do with the hymen growing back. How is sexual desire affected? Libido, or sexual desire, can be influenced by abstaining from sex, but the effect is different for everyone. Some studies suggest that going without sex for long periods may lead to a gradual decrease in desire. For some women, this might mean a loss of interest in sexual activity altogether. However, the opposite can also be true. Some women find that abstinence intensifies their desire, leading to stronger feelings of longing. This is a very personal experience and can vary based on hormonal levels, emotional state, and environmental factors. What about female arousal? When a woman goes a long time without sexual activity, her ability to become aroused may change. Arousal might take longer or require different kinds of stimulation than before. Female arousal is not purely physical, it's also deeply emotional and mental. Factors like environment, relaxation, and emotional connection with a partner can all play a major role. Can lack of sex affect the pelvic floor muscles? Sexual activity also serves as a form of exercise that engages the pelvic floor muscles, essential muscles that help control the bladder and support vaginal health. When you go a long time without engaging these muscles, they can weaken. In rare cases, this may lead to issues such as urinary incontinence, difficulty controlling urination, or experiencing minor leaks. There's no need to panic, though. This condition is uncommon, and there are specific exercises you can do to strengthen your pelvic floor even without having sex. One of the most effective is the Kegel exercise. It's simple. Imagine you're trying to stop the flow of urine. Contract those muscles, hold for a few seconds, then relax. Repeat this several times a day to maintain muscle tone. Another great option is yoga, which not only tones the pelvic floor, but also improves flexibility and mental relaxation. What about sexual frustration? Sexual frustration can gradually build up when you go for an extended period without sexual activity. During sex, the body releases feel-good hormones like dopamine and oxytocin, which contribute to feelings of pleasure, emotional bonding, and relaxation. When this hormonal release is absent, some individuals may start to feel more tense, restless, or even experience intrusive sexual thoughts and a strong desire for release. In women, this may manifest in physical sensations such as a heaviness or fullness in the pelvic area, increased breast sensitivity, or even heightened clitoral sensitivity. These sensations are the body's way of signaling unfulfilled desire. However, for others, the symptoms may be more emotional than physical, with noticeable signs like mood swings, irritability, anxiety, or even a general feeling of dissatisfaction. It's also important to acknowledge the psychological pressure that may arise when returning to sexual activity after a long break. Just like public speaking, working out, or riding a bike after years, resuming sex can bring about nervousness, insecurity, or even fear of discomfort. This is completely normal and something many people go through. With open communication, patience, and perhaps even the help of a professional therapist, it's entirely possible to ease back into a satisfying and enjoyable sexual life. Does abstinence reduce the risk of UTIs? Yes, sexual abstinence can significantly reduce the risk of urinary tract infections, UTIs. During intercourse, friction and movement can transfer bacteria, especially from the anal area, into the urethra, increasing the likelihood of infection. This is particularly common in women due to the shorter length of the female urethra, which gives bacteria a faster route to the bladder. When sex is no longer part of your routine, one of the primary pathways for bacteria is eliminated, meaning your chances of getting a UTI decrease substantially. That said, UTIs can still happen for other reasons, like dehydration, poor hygiene, or hormonal changes, so it's important to maintain overall urinary tract health regardless of your sexual activity status. Do you need to keep using contraceptives? If you're not having sex, the risk of pregnancy is basically non-existent, which means continuing birth control for pregnancy prevention is unnecessary. However, if you're using hormonal contraceptives, like the pill, patch, or injection, stopping them can cause noticeable shifts in your body. For example, you might experience changes in your menstrual cycle, a rise in natural vaginal lubrication, or even an increase in sexual desire due to the removal of synthetic hormones. These reactions are completely normal as your body adjusts to its natural rhythm. If you were using contraceptives to manage acne, heavy periods, or hormonal imbalances, it's always best to talk to your doctor before discontinuing. Also, keep in mind, if you ever plan to resume sex, you'll need to reconsider protection not just for pregnancy prevention, but also for STI protection, especially if you or your partner have other sexual partners. In conclusion, stopping sexual activity can bring about a variety of physical, emotional, and psychological changes. These effects are often temporary and tend to differ widely from person to person. Some may notice subtle shifts, while others might experience more intense changes. The key takeaway is this: listen to your body, honor your feelings, and most importantly, remember that your sexual choices are entirely yours. Whether you're taking a break for personal growth, healing, religious reasons, health concerns, or just because you don't feel like it, your decision is valid. You are not broken. You are not alone. Your body is adaptable, your mind is powerful, and your sexuality is uniquely yours. If you found this information helpful, don't forget to hit that like button, subscribe to the channel, and turn on notifications so you won't miss more videos like this one. We talk openly, honestly, and respectfully about topics that matter to your health, your body, and your peace of mind. Thanks for watching, and remember, your well-being always comes first.